Hi, everybody, and welcome to this episode of BariAftercare, the podcast. Today, we're going to be talking about why do I need a psychological evaluation to have bariatric surgery? And as promised, I have a new guest today, Dr. Joan Brugman, also a psychologist who does pre-surgical evaluations and who has also had bariatric surgery. So she knows what she's talking about from all aspects. So let me introduce you to Dr. Joan Brugman. Hi, Joan.
Hi, Connie. Hi, everybody.
Yay! So tell us about you. Where Tell us your story real quick. Like which came first, the surgery or the doctorate?
Oh, the doctorate. Geez, I've been doing therapy for almost, I don't know, 37 years. I've had my doctorate for, I guess, 35 years, something like that. A long, long time. So I had that before. I was in private practice when I had my surgery. It'll be 20 years this June. And
Oh,
then shortly after I had my surgery, I started doing these kinds of evaluations. Although I've done pretty much every kind of psychological evaluation you can think of because I've been around for a long time. So, yeah.
so you didn't have bariatric evaluation or bariatric therapy in mind when you went to get your PhD.
Oh, no, 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 no. Nope. I worked with kids for a long time, as a matter of fact. Although I'm not a child psychologist, I'm a general clinical psychologist. But I saw a lot of kids because way back in the olden days, there weren't a lot of people who would see children, and now there's a whole bunch of folks that
Yeah.
are happy to take them on. So then I switched over to seeing adults. But that wasn't why I got into psychology at all. So but my own surgery was a great reason for me to learn how to do bariatric evaluation. So it worked out for the best because I love the whole idea of helping people do this.
Yeah. So how'd you decide to have surgery? How did that come about?
Well, when I was in grad school, I lived in Florida. I went to graduate school in Florida, and that's not a place you want to live when you weigh just under 300 pounds. It's all that
Mhm.
sunshine and warm
Pretty
weather,
hot.
not so good when you're carrying that around. So that was pretty miserable. And then I just got to that point where I got a strong family history of heart disease and diabetes and all of the things that our folks talk about. I had orthopedic issues and all that. And I thought, at the time, I had, young kids, and my youngest child was 12 years old at the time. So I thought I was a Girl Scout leader. I needed to take those girls camping and walk up and down mountains and do things, and I couldn't keep up with them. So they knew that could not stand. I had to do something. So, and like all of our patients, had tried everything known to man. And at the time, the pills that you could take were phentermine, that makes your heart go. It made my heart go like that, and HC, human growth hormone shots. That didn't help. Nothing really sustainably helped because I had a really hard time staying on track. It was, behavioral issues for sure. So the surgery helped give me a leg up. But as we'll probably talk about, I was well aware that if I didn't stay on track, it wasn't going to be helpful at all. And
Yes.
particularly, I am a DS patient, and that is
Okay.
a very, very extreme kind of bypass. And if you don't stay on track, you are going to have serious medical problems. So that really scared me straight, which was a good thing. I needed that.
Well, it's really exciting because you had your surgery 20 years ago and you're maintaining a healthy weight. So you are in the perfect position to educate people about what it's like from a patient perspective and a professional perspective. So I know a lot of patients will ask, why do I need to have a psychological evaluation of bariatric surgery? So let's talk about that a little bit. Tell me what your perspective is. I mean, I think it's absolutely necessary. A lot of the literature would lead us to believe otherwise, and some surgeons would believe that it's not necessary. But you and I know better. So, why do patients need to have this evaluation?
That's a great question. In our program, we require folks to do an information session. I think that's true in most programs, good programs anyway. Um, and in our information session, I get the opportunity to talk for a half an hour on this exact topic. And so my structure is, I say, I'm going to tell you about the why, the what, and the how. And I start with why, this exact question: why do I even have to do this? And the bottom line, bare bones, because it's required by your insurance company. Point, period, end of conversation.
True.
Except why? And so I know a lot of people are really frustrated with insurance companies, and with good reason. And it feels like they're always trying to come up with some reason to try to delay you. They get your premium money and they don't want to pay out the benefits. I know it seems like that. And I can't speak for the insurance industry and all their decisions, but I know that's not the reason that they require this. The reason is because of the long-term research. And the American Society of Metabolic and Bariatric Surgeons and most surgical programs are going to follow the recommendations of that. The acronym for that is ASMBS. If ASMBS says you need to do this, most surgeons are going to go along with that recommendation, because they want people to have a successful outcome and a safe outcome. So, and the research says that the long-term research says if there is any kind of obstacle, and it might be a mental health issue, it might be a behavioral issue, it might be a logistical issue, like I don't have a place to live, or I'm on a restricted, limited budget, and I can't afford very healthy food. All food is expensive. That's a whole other conversation. But I've had, unfortunately, folks who say, yeah, I'm on a really limited budget and I can only eat what I can get from food banks. Um, and that's not a mental health issue in and of itself, but it is an obstacle that could keep people from being able to stick with the required post-operative lifestyle. It might be somebody else's problem. Example: I had a lady a few years ago whose mom lived with her, which was wonderful of her to let her mom live with her. But her mother was a person who suffered with paranoid schizophrenia, and
Mm.
she was very unstable. The woman herself that was coming to see me didn't have those kinds of problems, but her mother did. And it was so stressful for her. Every day she was waiting for the phone to ring, and it would be the police saying, all right, we picked up your mom again, roaming down the highway. And it was just this incredible stressor hanging right over her mind all day, every day. And
Hmm.
that was an obstacle, because stress in the mind affects your whole entire body. It certainly can affect your behavior, but it also affects the way your body processes nutrition. The hormones that control fat storage or fat dissolution are affected by the chemicals that are produced when a person is experiencing extreme stress. So it may not even be, that in that case, she was the person experiencing stress, but it was as a result of someone else's mental health problem. But it was
Yeah.
still an obstacle. And she ended up realizing that, and she ended up, putting a pause on herself, which was very, very wise, because she knew there was so much going on in her life, stress wise, that she couldn't even think of what she was going to eat, or if she was going to eat, or forget exercise. No way. I don't have time for that. I'm too exhausted because I'm so stressed out. So the long-term research shows that if a person has an obstacle to not just getting on track, because most people are pretty good about getting on track. I would not say 100% of people are good about that, but most people are. But staying on track is a whole
Yes.
other ball of wax. So if there is some kind of obstacle that might interfere with their ability to stay on track with all of the healthy lifestyle changes that you have to make with this journey, then there is a very high probability that you're going to have really severe medical problems, not even counting whether you gain your weight back or not, which you probably will. But there are lots of cases of people who didn't gain weight back, but they ended up with really serious medical problems, bad enough that they had to be admitted to a hospital because
Mhm.
they had a permanent change to their anatomy and they could not maintain a permanent change to their lifestyle. And that is dangerous. And the insurance industry doesn't want to see that happen to anybody. Surgeons don't want to see that happen to anybody. I don't want to see that happen to anybody. And so lots of times people will say, yeah, I know, I've heard about that before, but that's not going to happen to me. Well, I hope it doesn't. But to be responsible and ethical, we need to take a look to see if there's anything that we can see, at least up front, that tells us you might really have a problem with this and that this might not be a good choice for you, or it might be a good choice for you, but maybe not right yet. Maybe you got to make some changes in your life, or maybe you've got to get some coping skills to handle your stress or whatever, and then you probably could go through and have a fantastic outcome, and that's ideally what we would like to see. So
Oh, I love how thorough you are in that. And I'm so glad that you have the opportunity to give that information to patients at the information session. Because in my experience, those factors that we would consider to be obstacles to long term success. And I also love that you said whether it be a medical success or a weight loss success or both, because people don't think about that usually with or bariatric surgery. This is an opportunity for me to get this weight off. And I love that for people because it does get that weight off. But people don't understand the long term, looking at this from a long term perspective, and don't understand that big stressors or certain mental health issues or alcohol consumption or living with other people who, like you pointed out, can have such a huge impact. They're like, what does this have to do with bariatric surgery?
right. That's right. And sometimes the issue is not necessarily the other people's mental health issues. It could be, but how do they feel about you wanting to do this? And almost always people say, "Oh, they support me. They said that they're happy for me. Anything I need to do to be healthy and happy, they'll support me." And I believe that when people say that, that's what they mean, but
Yep.
it hasn't happened yet, because this is not like any diet program a person's been on. There's a lot of people in the world that think, first of all, they think, what does any of this have to do with bariatric surgery? They kind of think of it like going and having your tonsils taken out, and then
Right.
magically somehow your body's just going to shed all this weight, and the surgery will keep you from overeating, or it'll keep you from eating the wrong food. And what I say to folks is, listen, they're going to cut part of your stomach off. They're not going to cut your hands off. You can put anything in your mouth you want to,
I love that.
and as much of it as you want to, no matter how it feels in your stomach.
Yes.
So, it's important to get them to realize that, and that sometimes the people around them, even though they want them to be healthy, I mean, gosh, if you live with someone who says, I hope you're not healthy, then you should get out of that relationship. But most people are not in that situation. But when it comes down to having to say to them, hey, we can't have those Oreos in this house. My husband grew up eating Oreos, and potato chips were his vegetable of choice. Vegetable, no,
Mhm.
potato chips and ketchup were a vegetable in the house he grew up in. So, that's not going to be okay for me because it's too tempting for me. So we got to get that stuff out of the house. So I was extremely fortunate because he had the wisdom to say, oh, that's fine. He didn't push back on me, but he said, if I want Oreos or potato chips, I can go to whatever convenience store and get them myself. We don't have to have them here. And I told you I was a Girl Scout leader. You know what Girl Scouts do every January? They sell cookies, and I
Yes.
had to keep them. As the leader, I had hundreds and hundreds of boxes of Girl Scout cookies in my garage every single year. So, okay, what are we going to do about that? I literally had to ask one of the other moms in the troop, can you keep these at your house? Because I don't need that right under my nose when I'm going through this. And that was, somewhat of an inconvenience for her. And so sometimes other people are like, why are you burdening me with this? Why do I have to change my lifestyle? This is a you problem. Yeah, well, that might be the obstacle, and that we need to talk about that. So I tell people when I do my
Absolutely.
information session, if you're coming to me for your evaluation, you should have some conversations with the people in your life, your family of origin. Because if you get together with your family for Easter dinner or the 4th of July or whatever, a birthday party, and they're used to you eating the way you always did, or the way they do, they might not understand why are you making these changes, and what do you mean we all have those big Chinette platters, they're like a foot across, and you're going to eat on this little like
Right.
saucer. What's wrong with you? Don't you like the
Right.
food? Or you're losing weight
Yeah.
too fast. I'm worried about you. I think you need to eat more. Here, just have a little more. It won't kill you. Just make your mama happy because she made this cake for you. And there's a lot of pressure that people don't expect
Yes.
from the people around them, even though they want you to be healthy, but they were not expecting to have to make any lifestyle changes, and that
Yeah.
is hard, really, really hard.
And that is why we do pre-surgical evaluations, because even though it doesn't seem like, and I love your analogy of the tonsils, this isn't going in and have your tonsils taken out and the rest of life just goes on as normal. This bariatric surgery will result in changes in every area of your life. And I love that you tell people, have conversations with the people in your life. So the bottom line with it, why we do this is because even though many patients are very unaware of the long-term difficulty in maintaining, staying on track, we know because we've done this for a long time and the research shows it. And we've had experience, Joan personally and myself, not exactly with bariatric surgery, but other issues. So we know that there are things you need to know ahead of time. So, Joan, when you do a pre surgical evaluation, what are the things you include in that?
That's a fantastic question. So there's when you said this, the research was kind of lead us to believe maybe you don't have to do this. I think that in my reading of the research, I feel like there's support for something you could call an evaluation, but what is included in that's where the debate is.
Yeah.
Everybody seems to agree that an interview is necessary. How thorough the interview is seems to be up for debate. But I'll just tell you, I have had to redo psychological evaluations that were done by other people, not in our
Yep.
program, because everybody on our list is really well vetted. They're qualified, and we know they do a really good job and they do a very thorough job. But sometimes we get people who started the process in another state or something, and then they moved here and they already did the psych eval and they don't want to have to go through it again. So they submit it to the program, and then our program coordinator is extremely experienced, and she already knows what is going to happen when that hits the insurance company. It's going to get denied.
Right.
But so usually she can catch it ahead of time, but somehow if it got through the thing anyway and it got submitted, the insurance company will deny it if it is not thorough enough. It needs to include a
Exactly.
review of the medical record. The psychological evaluator is supposed to review the medical record, because sometimes people will forget to tell you things, like they had a history of alcohol abuse when they were a young person, or substance abuse, or that they've been on any kind of psychotropic medication or an antidepressant, or some people take other kinds of medicine that are technically antipsychotics, as to help their antidepressant work better. But they might forget to tell you any or all of that. Or there's none of that in the record, but what there is in the medical record is note that the person is not compliant with what the doctor or the medical provider tells them to do. So if we didn't
Hmm.
read that for ourselves, we might not see it. But I'll tell you what, those insurance company reviewers are going to read every word in that medical
That's
record.
right.
And if those kinds of issues are in the medical record and they are not covered in the psych eval, they will deny the person's request for surgery just on that basis. And that's why I've had to redo some of these things. So when I do it, I do a very, very, very thorough evaluation interview, and ask them all of these questions, certainly about their mental health history. And people are afraid, if I tell you that I've had depression, you're gonna think I'm crazy, or you're gonna immediately deny me, and I have to have this surgery for, they feel, they know the outcome can be so wonderful. A lot of folks feel kind of desperate to just tell you anything you want to hear so that you'll clear them, not understanding they could be putting themselves in harm's way by doing that. So, but we know a lot of people have mental health issues. That's not a deal breaker. If it is
No.
not in control, then it might be a deal breaker. But then again, that's not always a red light. That might mean what we call a yellow light. So, okay, I see this, but I'm not hearing you tell me you've got any coping mechanisms for this. So I would ask them, all right, so I see that you've got a diagnosis of whatever, anxiety or depression, ADHD, OCD, whatever, anything, including, of course, the sort of the heavy hitters, like maybe bipolar disorder, or you have been hospitalized because you had some self-harm thoughts or behaviors at some point in your life. So what I want to know is, what are your coping mechanisms for that? If you had a flare of that, even if the person says, yeah, I know, but that was a long time ago. I'm over that now. That's great. But if the world threw you a monkey wrench and you had a flare, how would you cope with it now? So before people come to see me, I want them to think about that, there will be a quiz on the information. So just think about it. And what are your mechanisms? And it could be anything that works for you. Having support people to talk to. Maybe you're already in therapy, you're on medication. It'd be great if you could use exercise to help regulate yourself. Faith is there's lots of research for accessing a faith base. So that's what I want people to tell me about. So we'll have this very lengthy interview, and then I always do some testing, and this is where the big debate is. Should you use actual tests? Why does it really help predict whether the person is going to have a problem or not? And I could nerd out and tell you all about psychological research and what kind of variables affect that. But the long and the short of it is that as you mentioned before, if you do a review and if you do like a search for, is there any reason for this? It seems like the consensus is, it doesn't really seem like it makes that much difference. Okay, I do it anyway, because if a person does tell me, if they're smart enough to realize they should not cover up any mental health issues that they have, do not cover that up. If you don't have good coping mechanisms, I want to help you get those things. That would be a good thing. More tools are better. So if you bring that up and they say, yeah, I do still have some depression, anxiety, or whatever, then I want to have some kind of quantifiable measurement. How severe is it? Is it mild, moderate? Is it severe? Is it extreme? So that helps me to gauge how much of an issue is this. And I know some things, some psychological instruments they're very transparent. If the question says, do you think about killing yourself? It's really easy for a person to say, oh, I better say no to that, because if I say yes, there's no way they're going to clear me. Right. So, is that going to be helpful? People could just sort of fake that, and then that's not helpful. But that's why I tell people ahead of time that don't do that. That's not going to be good for you. But then there are other instruments that have been shown to be really reliable. They're really valid. They're not easily fakeable. And those are very helpful because they're not just superficial surface things. There's some instruments that are about alcohol use, substance abuse, certainly eating behaviors, eating disorders. Examination is one of those kind of overeating is another one of those things. Binge eating skills, another one of those things. Because of course we have to talk about a history of the person's eating behavior, whether it met the criteria for a diagnosis or not. It might still be a pattern that we really need to make sure is in good control, because a surgery is not going to stop eating disorders from reoccurring. People think somehow that's going to happen, but it doesn't.
And sometimes people develop an eating disorder after surgery. So it's great that we test for those and let people know why and inform them that this may become a problem, even though it may not have been a problem in the past.
That's right. And a lot of people have told me, eating disorder wise, but also with depression, because a lot of people have depression and a lot of people have trauma. That's another thing that should
Yes,
be looked at in this.
yes.
If I could just get this weight off, that would fix all my problems. Well, no, probably not. And it actually might make the problem worse in the long run. So,
Yep. And I love that you are so honest with people. And I think that is incredibly important because, there are some, unfortunately, evaluators out there who just are also checking off the box. But I know from working with you and having and
yep,
discourse with you that when you get a psychological evaluation from a person who genuinely cares and genuinely is thorough, you are getting a blessing. Even if you're like, oh gosh, I didn't want to know all that. I didn't want to think about all that. I hadn't even, it's a blessing in disguise. And the truth is, I don't know for you, Dr. Brugman, but for myself, it's not very often that I absolutely flat out say, this isn't going to happen. You are in no
right.
position to have this surgery for this reason, that is not very common for me. And then I'll
That's right.
ask you the same thing. For me, it's very common to say, you know, you're cleared for the surgery, but what I want you to understand is, you're in therapy, you've been in therapy, you're working on coping skills. That is all great and wonderful. I would encourage you to talk with your therapist about the importance of coping skills when you have a flare of anxiety or when the depression or if the, thing surfaces again, because one of the biggest problems is a lack of healthy coping skills. That's when people
That's
fall
right.
off the rails.
Yep, that's right. Bear with me. I gotta move around a little bit because I don't want my computer to run out of its battery, but we can keep
Sure,
talking.
sure. Yeah. So, I mean, in your experience, the vast majority of people are cleared for surgery. If there's an active mental health issue, what's important to me is that they are in active therapy, with a therapist who's dealing
That's
with
right.
the issue that they are struggling with. So, if they've been in therapy in the
Hmm.
past, but they are no longer in therapy, then I will say, listen, I appreciate your value of mental health. In order for me to clear you, I am going to require that you return to your therapist or find a new therapist because you've had these issues in the past. And from my experience, this is likely to surface again. So, do you have that kind of thing happen?
Yep, absolutely. Sometimes I can work with a person myself if I haven't, if they don't have somebody that they feel like they can work with. Not all evaluators feel comfortable with that. They don't want to be in the position where it looks like they're trying to generate business for themselves.
Correct.
Um, but I am not involved in the getting people on the table. That's not my job.
Right.
So I feel like I've got a little bit more leeway there. Um, but if they have their own person, I definitely tell them to stick with that person for sure, especially if they know anything about eating behavior. And if they don't
Right.
have somebody, then in for whatever reason, maybe not a network, or they just live too far away or something, I would encourage folks to look for somebody who has some understanding of this. And not everybody is a believer in bariatric surgery. Sometimes folks
Right.
feel like it's just too risky, it's too extreme, or something. So, I don't want to say that you should, you know, um, kind of try to, pardon the pun, but, tip the scales. But get somebody who's going to be supportive of whatever your choice is and not try to talk you into something that they think is better.
And
Somebody
yeah,
objective.
it is really difficult. It's difficult for people to find experienced people who have worked with post bariatric or long term weight loss, regardless of the method of weight loss. And so sometimes, if I have room in my
Hmm.
schedule and they want to continue with their other therapist and work with me, I will do that. Or sometimes if my schedule, yeah, it's like, yes, I'll be happy to work with you. If somebody's got like
Right.
unresolved childhood trauma. Now I know from looking at your Vita that you have experience with EMDR and trauma history. I refer people out for that because it's not my area of expertise, but I think it's absolutely critical for people with unresolved trauma or histories of trauma at all to see somebody to work through those, because that is a barrier in my estimation. And even if people say that happened 20, 30, 40 years ago, I'm like, listen, that can affect your self-esteem, it can affect how you feel about yourself, and that's going to affect how you behave toward yourself. So a lot of times people get annoyed
That's
with
right.
me initially, and they'll say, oh, fine. And then I'll say, you need to check back with me in 3 months or whatever it is. And then they're like,
Hmm.
that's the best thing I've ever done. Thank you so much. I'm going to continue in my therapy. Therapy is a great and wonderful tool because so many of us, we may be strong in many areas of our life, but it always helps to learn coping skills. And this is a
Yes,
whole new area of life. Your relationships are going to change, all those things change. Before we
that's
get into
right.
all of that, do you have anything that you would absolutely say, no, this is a deal breaker for me in terms of approving you for surgery? Can you hear me okay? Uh-oh. You okay? Or you hearing me okay? I'll let your sound get settled over there, and I'll talk about what for me might be an issue where I say, listen, it's not looking like bariatric surgery would be good for you at this time. It's not a no, but it's if we address these things, and certain things like that would be if a person has been drinking heavily for the last, however long. I don't know how long that would be, but alcohol, if it meets the criteria for an alcohol use disorder, that needs to be addressed before a person, in my estimation, could be cleared for surgery. Or if a person has had an active suicide attempt in the last year, the insurance companies are very likely to say, no, you need to be in therapy for a certain amount of time before we can clear you for that. But understand that having depression or bipolar disorder or schizoaffective disorder or many mental health issues is not an automatic no. It's, has it been treated? Are you in therapy? Are you on medication? And if your doctor has prescribed you an antidepressant or an anti anxiety medication, that doctor ought to also be requiring you to be in therapy, because the literature is very clear about medications. They help on their own, but the best result is if you're on medication and in therapy. If you're on therapy for depression and you don't deal with the issues related to the depression, you're just masking the symptoms. And yeah, life can be easier that way. But if you want to work through those things, so those kinds of diagnoses are not necessarily going to prevent a person from having or being approved for bariatric surgery. But the recommendation will likely be get some outside therapy, do some, um, do some therapy on your own, address this issue, learn some coping skills, and then I'll meet with you again in a certain amount of time and we'll reevaluate. And people do tend to get quite upset about that. Um, but it's in the best interest of the patient. And like Dr. Brugman and I both have said, the reason we do these evaluations and the reason that a psychological component is part of the multidisciplinary team. I can hear you back there, Dr. Brugman.
Yep, I'm
Um,
back.
okay, I can't see you. But the bottom line is we want you to have long-term success, not just the success that comes from the surgery itself. So what the question was, Dr. Brugman, is, are there anything that you would say, surgery is not off the table forever, but for now, we need to do these sorts of things and then reevaluate. And what would those things be?
Right. So for things that are not deal breakers, that's a different question. But if a person, for example, has a kind of mood disorder that tends to get really difficult and interfere with their life, and then maybe after a while it seems to get better, but then it comes back and then it gets better and then it comes back again, that's something that they need to get stable before they go forward. Eating disorders, the thing that jumps to everybody's mind is binge eating disorder. And that's one kind of eating disorder, but it is not the only one. We want to see people be stable for some period of time. In our program, the guidance I've been given is at least 3 months. That seems a little shy, but it might, depending, that
Agree.
might be good enough. Maybe they need to do more than that. So if they have other behaviors that are out of control, it might be some other kind of impulse control disorder, like example ADHD. And you wouldn't think that would be a yellow light. What does that have to do with anything? But this is my other area of specialty. So if people have a hard time knowing when to stop, that could affect anything, whether it's eating or frantically trying to, um, fixate on what their diet is supposed to be like, or it could be exercising to the point where they're eating up too much of their muscle mass if they're not replacing that with nutrients. So we want to make sure that people have a really good handle on how to stop themselves and when it's time to
Yeah.
shift gears. So in my experience, sometimes I'll say to people, let's work on that a little bit. That doesn't happen very often, though, because usually if people have ADHD, in my experience, they know it and they're either in treatment or they've got some, behavioral mechanisms in place to help guide themselves. So that's what I want to see. But cycling mood disorders, especially eating disorders, especially if there is any ongoing issue with alcohol, that is something that needs to get under good control. The surgeons won't touch people in our program if they've got any nicotine in their system. They have had any, again, for
True.
at least 3 months
True.
because of the damaging effects of nicotine on the stomach lining. So if people are having to use short acting anxiety medicine like Xanax, and they're having to do that with any kind of frequency, that's something I want to see get under control.
Yes.
I don't mean that they can't have anxiety, but those kinds of things can be addictive.
Yes.
That can be its own special issue in terms of addiction. But it usually means that they don't have good coping mechanisms for handling that anxiety. And as I said, stress affects the body. So
Absolutely.
does
Yeah.
that ring true with what you do, Dr. Stapleton?
Completely, completely. And you brought up some things that make me think, oh, I need to check more for, like the mood cycling disorders. I need to be more thorough about that. But all those other things, absolutely.
Mm-hmm.
If somebody's actively binging or actively purging, that needs to be stabilized because that could be very dangerous physically and emotionally. So, yeah, I
Right.
agree. So I think it's really important that when people, either if you've had weight loss surgery, if you're thinking about it, or if you know somebody who's thinking about it and they're complaining about, oh my God, this check, yeah, why do I eh, help them understand that all of these things are thought out and planned to help them have long-term success. Because so many, when I do evaluations, it's hard for me not to even say this with sort of a sarcastic smile, but people are like, yeah, my friend had surgery a year ago and they're doing really great. And I'm like, well, yeah, they're probably losing weight really well, but are they following what they've been told to follow in terms of how to eat? And are they incorporating exercise? And are they attending support groups? Because losing weight is not the indicator of doing great. Doing great
No,
is changing the life.
that's right. The number
Take,
on the
take it
scale, to
over
me,
from there.
that's a side effect. Yeah.
Yeah. Absolutely. So we are both very much on the same page. And I absolutely want to give a shout out to your program. It's the North Carolina Bariatric Institute, and you're part of the Fry
Mm-hmm.
Medical Group.
Mm-hmm.
And I
Yep.
know in my heart that you were very instrumental in getting BariAftercare in your program, because you know and you have lived and you understand the absolute critical nature of long-term aftercare. And everybody at your staff is 100% on board with, we need to fully educate the patients. We need them to understand that this is not having your tonsils out and going on with life. This is every area of your life will change. So go ahead and just talk for a few minutes about your passion for this and whatever you'd like to say.
Yeah, I was so thrilled to be able to finally get the powers that be to buy into this, because when I was in private practice for a really long time, and I was the boss, and whatever I wanted is what was going to happen. But I'm not the boss of this hospital system, and so the corporation that owns our hospital decided that they wanted to go in the direction of creating an institution, and then they put a wonderful nurse leader in charge of making it happen. And she said, boy, this is a really new area for me. And I said, oh, good, because this person is open to information. And I said, hey,
Yes.
look, I know this psychologist and she's got this amazing program. And, our program coordinator has been the main support person. This program's been around for almost 25 years. And up until now, until we got Bariatric, when anybody would have any issues, they were calling her, and she's amazing. But she's
Yeah.
also the program coordinator. She's also the dietitian. That's a lot of balls to juggle. So I said, if we're going to really grow, we got to get more support services. And people ask me all the time, do you have any online support groups? I do an in-person support group once a month,
Awesome.
but it's only in
Awesome.
person. And we don't have a lot of technology. I know I personally don't, and even the hospital doesn't have a lot of that. So it's just whatever. It's just what it is, what it is. So it was absolutely perfect timing that I was able to bring it to this person who was wide open for ideas and
Oh,
say, hey,
wow.
this is something patients really want, they're asking for, they really, really need it. And, sometimes they want to do support groups, which is fantastic in bariatric care because every week there's one. And
Right.
so then they're not locked into, it has to be one time, once a month. If you miss it, you got to wait on another
Right.
whole month. So there's lots of flexibility there. But sometimes people actively participate in things like that. And sometimes they're participating sort of in the background. But what I hear
Yeah.
from folks is that they love knowing that they're not alone, because they
Mhm.
have very often felt like nobody really understands what it's like to live in with a body with these kinds of issues, or to feel the way I feel when I'm in a group of other people and I feel like everybody's looking at me and judging me. And it's just a life changer for them to know that as they're going through this, if they want to ask questions, they can ask them. There won't be any judgment. And that is huge. So, for people who are in maybe listening or watching online and they're in some other program, try to find a support group for yourself, that where that
Right.
you're not alone. And when you have questions, you can ask, what do I do about this? What if I don't like that kind of protein? What if, and there are people that won't judge you for that, and they know what you're going through, not just any, Yahoo on social media, because you're not always going to get the right information.
Do you still have a private practice in addition to your full-time job?
Yes, ish. I do. I have just a few people that I still see like once a month. I still own the
Right.
building, so I got to pay the mortgage on the building.
Oh, wow.
And there's a few folks that are just long-term maintenance, just to have somebody that already knows them. They didn't want to start over again with
Right.
somebody else,
Right.
and it's just sort of a touch base. So that's
Okay.
fine for me. And I don't do a lot of that. I for a little while I would do some other kinds of evaluation things. I don't do bariatric evaluations in my private practice anymore because I have a contractual obligation to
Conflict
my
of
employer
interest.
now,
Yeah.
so that's a
Right.
conflict of interest. I used to do them
Right.
for all the programs in the entire Charlotte area, but I don't do that anymore.
Wow.
So yeah, then there's several programs. So um,
Oh, wow.
yeah, so
Okay.
I'm thrilled to death that to be able to give people the resource and having this podcast. That's how I came across you, was listening to this podcast. And
Oh,
I say to folks
really?
that even if you can't do bariatric care, which I really encourage people to
That's right.
do because it is really,
Right.
really worth it. And it talk about a good value for the whatever the price is. I'll tell you what, there's so many things that people get that, as we've talked about before, it could almost be overwhelming because there's so much.
Yeah.
And as I said
Yeah.
earlier, the more tools, the better. You don't have to use all the tools, but
That's right.
knowing that if
Find the ones you
you
like.
need a particular thing, you've got it.
Yeah.
So,
Well, your
yeah,
contribution to BariAftercare has been phenomenal. I want to thank you for that. And I am really looking forward to having you on the podcast regularly if you're interested, because
great.
you
I'll
have
get better
such a wealth of
technology.
knowledge. You have such a wealth of knowledge, though, and so much great experience personally and professionally. And I learned a lot from you. And I appreciate you so much talking about this topic today. And you'll be
Love it.
back in a couple of weeks. We got some other fun things we're going to be bringing up. So thank you
Mhm.
for all of the ways that you have enhanced bariatric and my the way I practice too. I really value you. So, and I can't wait. I loved coming to your program and getting to meet everybody. What an amazing group of people. And you were gone that day. It's probably a
Yeah,
good thing because I'd still probably be sitting in your office and we'd probably still be chatting. But I'm coming back and we're going to have a fun weekend.
good,
Okay.
great.
Well, thank you
That's
for being
awesome.
with me. I got to run because I got another patient in just 1 minute. So it was delightful. Thank you
Mhm.
so much. And this will air
Thank you.
Wednesday.
Anytime.
I think it's February 19th. All right. Talk to you soon. Have a great weekend, everybody. Bye bye.
Bye.